son was 9 months old, he was diagnosed as being mentally retarded, which at that point in time was the appropriate descriptor, but later it changed to intellectually, developmentally disabled. And he was described as retarded until he was in his early teens when the mental illness kicked in. And he became very difficult to manage and very difficult to find appropriate doctors to deal with him.
Trinitas Behavioral Health is different from other hospitals and facilities for a couple of reasons. We provide some of the most specialized programs and services for very distinct populations. We recently became a certified behavioral health community center, which is a recognition of the expansive services that we offer and that we provide integrated care for children, adolescents, and adults.
There is a category for individuals that have a developmental disability and a mental illness, sometimes referred to as dual disordered, or more formally DDMI.
So the patients that are included in the DDMI population vary in functioning levels. So an individual could be nonverbal, and then you can have somebody who's fully verbal and functioning on a lower IQ level, but able to communicate their needs. We also have individuals who may have been hit by a car or had some type of a serious accident where they became developmentally disabled later on in life.
Developmental disabilities occur really across the span of people in terms of demographics, does not discriminate.
And really, DDMI individuals are our neighbors, and they are often living in our communities in group homes that are supported by various agencies and wonderful staff.
I'm very happy to work with this population, and I think the staff are very enthusiastic, very committed, and very compassionate about this population, sometimes for family reasons. I myself had an uncle who was severely developmentally disabled, and my grandmother took care of him all of his life until he passed away.
We've had a series of psychiatrists and hospitalizations, and they were everybody meant well, but they didn't do well. We had, some very fine doctors, we had some very fine hospitals, but it just wasn't right. And it was almost 2 years ago that we had our first experience with Trinitas and its amazing MIDD unit. During this time, he was, managed beautifully, came out in really much better shape, and went back into a group home.
Well, the type of therapies are the full range of medications, psychotherapy, adjunctive therapies.
We also work on gross motor activities.
Art therapy, creative movement, music therapy, yoga.
Over the last number of years, the two remaining developmental institutions in the entire state of New Jersey closed. So the primary reason for expanding is simply to accommodate the number of people who are in need of that specialized unit.
Families move to the state of New Jersey because of programs and early intervention services that are desirable nationwide.
It's the only unit of its type in the state, and it only has 10 beds, which, given the size of the state and the population of clients who would fit those services, is really scandalous.
We often have a waiting list of over 10 people across the state in emergency rooms who are waiting days and sometimes weeks in order to access one of the very few beds that are available right now. It really fits into what the mission of Trinitas is, of being dedicated to God's healing mission and to identifying people that are vulnerable, that are underserved, and providing compassionate care and a quality of service that everyone deserves.
There's really nothing that's comparable to what Trinitas offers. And I really implore you to give serious consideration to the contribution that you could make today that would make a difference in their lives forever.